Growth in children. Epiphyseal contribution of long bone growth. There are growth plates within these bones. This growth distribution in the humerus is about 80% in the proximal area and 20% in the distal. Displaced fractures of the proximal humerus in children are usually treated without surgery. Next is the ulna and radius. The growth distribution in the ulna is about 80% proximal and 20% distal. Growth arrest is common in fractures involving the distal ulna. This is approximately 50%. Within the radius, it's about 25% proximal and 75% distal. Fracture of the distal radius usually heals and corrects its angulation after closed reduction. Surgery is rarely necessary. Fracture involving the growth plate of the distal radius rarely involves growth arrest. Within the femur, the growth distribution is about 30% proximal and 70% distal. Fracture involving the growth plate of the distal femur may cause major growth disturbances. It is expected that a child grows 1 centimeter per year from the distal femur growth plate. Boys will grow up to the age of 16 years old and girls will grow up till 14. And finally, the bones of the tibia and the fibula. Growth distribution in the tibia is about 55% proximal and 45% distal. Within the fibula, it is about 60% proximal and 40% distal. A growth spurt occurs at the time of puberty. Puberty typically occurs from 8 to 13 years of age in girls and from 10 to 15 years of age in boys. My child is healthy and growing stronger by drinking his milk. And by not smoking, drinking, taking drugs or steroids, my child's future is looking bright.
All my videos and this video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.